Hello, I'm Dr. Leigh Ettinger. Thank you for joining me on this webinar. First, a medical disclaimer. While I'm a gray hair doctor, I'm not your gray hair doctor. So this presentation is for informational purposes only. In this webinar, I will share with you a true story from my own practice about a boy who was having two significant health problems from eating too much protein. This boy was 4 years old. He had normal growth and development. He was admitted to the hospital where I was working as a pediatric kidney specialist. He came in with a very severe skin infection, a cellulitis, that required IV antibiotics. It was learned that he was developing a mysterious intermittent rash over the upper parts of his body. His mom said that this rash wasn't itchy or painful, but that he wouldn't be quite acting like his usual self when it would occur. His pediatrician and an allergist were treating this rash with a topical ointment. His admission labs were concerning for a serum creatinine of 1.3, which is elevated. So, as the pediatric kidney specialist on service, I was called with a consult with a question: why does this young boy have such a high serum creatinine? Creatinine is made by the muscles and goes into the bloodstream. This guy with the big muscles makes a lot of creatinine. Me, not so much. The creatinine travels in the bloodstream to the kidneys, where the kidneys clean the blood and put the creatinine waste into the urine. Someone with kidney disease is not able to clean the creatinine out of their blood as well, and creatinine builds up in their body. So the hospital team asked me to figure out if this boy had kidney disease. Over the next few days, while he was getting his intravenous antibiotics, I ran all sorts of tests. All of his kidney studies were normal, and he left the hospital a few days later with a normal serum creatinine, normal kidney function. As I was walking down the hospital later that day, the other doctors and nurses were giving me high fives and fist bumps and saying, "Great job, Dr. Inger. You fixed his kidney problem." But no, it wasn't quite like that. But he did improve, and I didn't still know exactly why his creatinine was high in the first place, and I'm not quite sure why it improved. So I did what any self-respecting doctor would do, is I asked to see him back in a few weeks in my clinic. Well, a few weeks later, his serum creatinine was back up to 1.2. So he had a decline in his kidney function, which made me wonder what was different about what was going on at the hospital versus what was going on at home. Was there something in the environment at home that would be causing this kidney problem? Was there a medicine that was being given, or maybe a medicine that was not being given? All of the usual suspects weren't there for this child. So I had to think more broadly. And I wondered, maybe there's something going on with what this child is eating. So I had mom fill out a chronometer diary. This is a program that tracks nutrients and intake and can really give a very clear picture of a child's diet or an adult's diet too. Mom returned the chronometer diary, and it showed that this boy was getting 150 grams of protein per day. That's 8 times the recommended daily allowance. And at first I thought this must be an error. How do you get a 4-year-old to eat 8 times the recommended daily allowance of anything? I mean, mostly aren't they running around at mealtime and then they grab a French fry and run around some more? But it turns out that mom was giving him meat smoothies, and he particularly liked lamb. So he didn't have to chew all that protein. He was drinking all that meat and protein in a smoothie. And I asked mom, why is she doing this? Why is she giving him these meat, high protein smoothies? And she said that she wanted to make sure that her son got enough good protein to grow. And I really don't blame her for this. There's this great urgency these days that we all get enough protein, that people get good, high quality protein. Let's take a moment to look at the marketing out there. Here's a protein shake product, usually for men. And for the women, we have products that are wrapped in pink. And then look at this shampoo with bodybuilding protein. I'm not sure if she's supposed to drink it or put it in her hair. Get your protein with your coffee, get your protein with your breakfast cereal, and of course, get your protein with your meat. With all this messaging out there to encourage protein, it's not a surprise that some people might take it too far and either eat too much protein themselves or perhaps even give too much protein to their child. I'll admit that I too was worried about this protein issue. I really enjoy cycling. I first learned about the plant-based diet from a fellow cyclist back in 2014. I researched it and decided to give it a try. And I'm really happy to report that even though I've only eaten plants since 2014, that my cycling has gotten even better. Here I am in the summer of 2022, cycling on a 6-day tour through the Pyrenees Mountains of France. It turned out that the plant based diet was good for me and my health and my cycling, but would it be right for my family? This isn't my family, but it could be. I have a wife and twins and a younger daughter. And back in 2014, when my wife and I did decide to become plant based, our 3 children were in elementary school. So we had to do a hard look at the plant based diet to see if it would be right for growing children. Certainly, my background in pediatrics, and especially in pediatric kidney disease, helped with this question. We have an expression in pediatrics: you only get one chance to grow. And in pediatric kidney disease, growth can be especially problematic. Kidney disease can cause all sorts of deficiencies. A lot of my clinic time was spent helping families adjust medicines, adjust diet, adjust supplements in order to encourage growth. But I didn't think that this boy had any kidney disease. All the tests that were done in the hospital were normal. And here is the proof. Remember, creatinine is from muscle. So this boy's muscles were putting some creatinine into his bloodstream, but then he was drinking all those meat smoothies, and meat is animal muscle. So he was ingesting a tremendous amount of creatinine from the meat smoothies. And that creatinine would go into his bloodstream, and that's what we were measuring in the abnormal blood tests. I had mom stop the meat smoothies and give the child a more balanced diet, although I don't like that term. But without the meat smoothies, his serum creatinine returned to normal. No longer was he being flooded with all that extra creatinine. Well, that explains one mystery, the mystery of why he appeared to be in kidney failure. But what about this other mystery, this strange intermittent red rash that would appear on the upper parts of his body? Well, something else jumped out at me from Chronometer. He was getting 3 times the recommended daily allowance of niacin, vitamin B3, which is found in meat. All of that niacin in the meat smoothies was causing this boy to have a niacin flush. This is a prickly heat kind of sensation that happens over the upper parts of the body soon after ingesting a large dose of niacin. It's due to blood vessels in the skin opening up, kind of like a blush. It's not an allergic reaction, it happens to just about everybody. It's harmless and usually subsides within an hour or two, usually about the time it took mom to put an ointment on the skin. It was going to go away anyway. And this niacin sometimes sneaks into products that you might buy for a detox or for a cleanse. It kind of makes you feel like maybe this detox is working, that toxins are leaving your skin. Now, it's interesting. The 2 problems that this boy was having were not actually due to the protein. They were due to the meat, that the meat was giving him too much creatinine and a tremendous amount of niacin. Now, what if mom had instead decided to give him an off the shelf protein powder, for example, in the smoothie? Well, what would happen to all that extra protein if he was getting 8 times the recommended daily allowance of protein? Well, let's talk about protein for a moment. Protein is built up of amino acids which have the element nitrogen in them. It's actually the only significant way that nitrogen gets into our body. And the role of the nitrogen and the amino acids and the protein are as building blocks for many parts of the body. They also are important for many functions like blood clotting and in our immune system and acting as hormones and transporters in our body. A protein has gotten this kind of magical quality. Protein will drive you to the airport. It'll shine your car. I mean, it's really getting kind of ridiculous how much is attributed to protein these days. But what actually happens in the body if extra protein is eaten? Well, a lot of it turns into nitrogenous waste that gets urinated out in the form of urea and flushed out the toilet. Extra carbohydrates get stored as glycogen or fat. Extra fat that's eaten gets stored as fat. But extra protein that's eaten just gets urinated out. I think that this may be why so many diets encourage extra protein, because yes, it's important for all these roles in the body, but then the extra just gets urinated out and not stored. So, how much protein does a person need, especially a growing child? Well, it's been studied with nitrogen balance studies. They're not perfect, but they give a good estimate of how much protein a person needs. Using this formula, multiply the person's weight in pounds times 0.36, and the answer will be their recommended daily allowance of protein for the day that will meet the needs of 95% of the population at that weight. So, for example, a 100-pound person should be getting in at least 36 grams of protein per day. Less than that, and they're at risk for malnourishment and having to break down their own body's protein. More than that, and they're getting adequate protein and probably some extra. Let's review the lessons that we learned from this story about a boy who was eating too much meat. First of all, too much niacin, too much vitamin B3 can cause an upper body flush. Really excessive meat intake can give the appearance of kidney failure in a child. When too much protein is eaten, it's just urinated out as nitrogen waste. Chronometer saves the day. Now, this isn't a commercial for Chronometer. I'm not paid by them. It's just a program that I like to use with my patients. It really gives a tremendous amount of information that can help guide diet choices. And lastly, sometimes hospital food can make someone better. That was really the clue that this boy got better in the hospital when he wasn't drinking those meat-filled shakes. To find out more pediatric plant-based nutrition for your family, enroll in the How to Nourish Your Plant-Based Child e-course. Invest 2 hours of time for nutrition education that will last a lifetime. There's actually no recipes in this e-course. Rather, you will gain a very clear understanding of how to select the best recipes for your family based on your growing child's nutritional needs. On the Dr. Herbivore website, you can also sign up for the mailing list for even more free content and for notifications about appearances. Thank you for joining me today. Goodbye.